Hi everyone, in this video I'm going to be talking to you about what a glossectomy is, the types of procedures that there are, and how it affects our speech and swallowing. The easiest way to define a glossectomy is the removal of the tongue, which is one of our major articulators and a vital organ. The reason our tongue is so important is because it is responsible for a handful of functions such as mastication, which is chewing, deglutition, which is swallowing, gestation, which is taste, speech, which is the sounds, words, and phrases we produce, and articulation, which is the clarity in our speech production. The first and most common reason for a glossectomy is squamous cell carcinoma, which is the most common tongue cancer. Squamous cells are skin cells covering the lining of the mouth, nose, larynx, thyroid, and throat, and a carcinoma can be defined as cancer starting in the cells making up skin and tissue linings. Some symptoms of skin cancer can be pain and bleeding in the mouth, a red and white patch on the tongue, jaw swelling, even vocal changes. Less common cancers resulting in glossectomies can be adenoid cystic carcinoma, which develops in the salivary glands, or alveolar soft part sarcoma, which can be seen in the head and neck regions and is a cancer coming from types of soft tissue. Obstructive sleep apnea can be another reason a person will get a tongue resection. It's a pretty common disease that can be seen in people of all ages, but more frequently in those older in age or larger in size. What happens with sleep apnea is your breathing interrupts your sleep because there is a blockage of airflow, and your tongue can be playing a big part of it. Most people rely on CPAP machines, but there are cases in which people remove part of their tongue. A final reason I will mention that results in glossectomies is macroglossia, which means that an individual has an abnormally large tongue. Typically, this is seen in individuals born with Down syndrome, which is when a person is born with an extra chromosome. Another individual that can have macroglossia is someone who has Beckwith-Wiedemann syndrome, which is a growth disorder. Or they can have Hurler-Hunter syndrome, which is when they can't digest sugar, so undigested sugar molecules affect other body organs, possibly the tongue. There are a number of different types of glossectomies that can be performed on patients. The first one is a partial glossectomy, and that is when less than half of the tongue is removed. Here on the infographic, you can see an example of what that may look like. Here you see that less than half of the tongue is removed. The second type is a hemiglossectomy. That's when half of the tongue is removed laterally. And here next to the partial glossectomy, you can see that as well. The third type of glossectomy is when less than a total glossectomy is performed, but more than a hemiglossectomy is performed. And here you can see that as well. And if you haven't guessed it, a total glossectomy is when all of your tongue is removed. And here's what that looks like. Depending on how much your tongue is affected by any of the listing pathologies, your doctor will decide how much of your tongue will need to be removed. That will also help them determine which surgical approach to use. A transoral glossectomy is the easiest approach because it requires the least amount of steps and it requires the least amount of time. It is the removal of the tongue tissue through the mouth. However, this method does have limited exposure, and for glossectomies due to cancer, you'd want as much exposure possible for a successful resection. For tongue cancer, doctors would most likely go with the glossectomy via lip split mandibulotomy approach because it gives the widest exposure for an easier tumor resection. It's also done to have access to the back of the tongue. However, this approach carries the most risk for failure and is the most time-consuming approach. One reason for the wide exposure is the opening of the mandible, and after tongue resection, mandibular reconstruction is needed in order to complete this approach. That's why it carries the most risk and the most steps, and it is the most time-consuming. The third method that doctors may use is the glossectomy transcervical pull-through. This method is less time-consuming because the mandible does not open, However, the floor of the mouth does open, which releases the tongue into the neck for visualization of the back of the tongue. Another way in which doctors decide on which surgical approach to use is through the T&M score, which is primarily for cancer patients. The surgical approach can be determined by the size of the tumor, if the tumor has traveled through lymph nodes, or if the cancer has spread to more distant bodily structures. Because we have advanced so far medically in society, doctors have found ways in which they can not only fill the tongue space in which they have resected the tongue, but they can also restore tongue function. They can do so by using skin grafts and structural flaps. One of the more favored options is the buccinator myomucosal flap because it uses parts of the orbicularis oris and parts of the buccinator muscle which has mucosa on it. This flap has enough bulk to allow for almost all tongue restoration. The pectoralis major flap uses parts of the pectoralis major, however, it only gives subpar results for tongue restoration. With every surgery, there is a recovery process and there are surgical risks involved. Hospital stay depends on the type of procedure that one may get. For example, a patient who has had a glossectomy via lip split mandibulotomy for a total glossectomy would obviously stay longer than a patient who has had a successful transoral glossectomy for a partial glossectomy. Oral hygiene and a prescribed soft food and liquid diet is vital for the healing process of a glossectomy because you want to prevent any infections. Patients will need feeding tubes, and the time frame for those are determined by the doctor. Fevers and pain is normal after the operation, so having people to help out with normal tasks may come in handy. It's also important to practice exercises a doctor or speech therapist recommends for a quicker recovery. A couple of risks that a patient may experience post-op can be dysphagia, which is when a person has trouble swallowing. Aspiration is another risk, and that is when foreign objects get into your lungs, such as food and water. Dysarthria can also happen, and that's when your muscles are too weak to allow you to talk. And other risks, such as general anesthetic risks, are always a viable option, such as respiratory issues, infection, and ultimately death. Because the tongue can move in many different directions, it is responsible for almost all oral functions, such as chewing, swallowing, and the sounds we produce when speaking. One of the most significant factors when it comes to our speech is our intelligibility, or the ability to be understood. When the tongue is removed, we are unable to produce most of our vowels and consonants, and this is why speech therapy is vital following a glossectomy. Most patient improvement is seen in patients who are consistent with their therapy, even those who have had a total glossectomy. Speech therapists who specialize in swallowing are also fantastic resources. Following a tongue resection, patients may experience dysphagia and aspiration, which can harm other parts of our body. With range of motion or tongue-resistant exercises, patients have the opportunity in restoring their swallowing functions. Finally, like many other parts of the body, there are prosthetics that can allow a patient all or almost all tongue function restoration. That is basically what a glossectomy is, and I really hope that I've given you enough information to understand what a glossectomy entails.